just so our audience knows, what's the difference between an emergency room and an urgent care setting?
So emergency room usually is attached to a hospital. Urgent care is usually a standalone facility. And usually they have different capabilities. And in urgent care, usually they can at least do an x-ray, do some diagnostic studies, evaluate, and they can start the ball rolling for management and kind of point you in the right direction. They can't admit from an urgent care. Usually they have to transfer from there to then an ER to admit you in case you need to do something surgical right away.
So taking a step back to concussions, I think it's important to tell our audience, it's important to be seen by somebody, by a professional for sure, just to help give you some guidance and treatment on what direction to go, whether or not you're going to be okay or whether or not you have to go to an urgent care setting or an emergency room. Yeah,
no, I agree. I mean, if something happens to you and you're by yourself or that kind of thing, then you need to be evaluated by some kind of a professional, either go to your primary care or go to an urgent care. But definitely, if you're by yourself in that setting, or if you're with one other person, but there's no one around, then I would definitely take them to get evaluated.